we have. All right. Okay, so here's our website. So on the front page of the website, we have our data that we've been collecting this whole time, right at the top. So we have our case count, our hospitalization count, and our death count. And thankfully, we haven't had any deaths since March. So everyone's been doing a really great job at following our public health recommendations and really trying to implement those practices to keep us safe. On this page, also at the top, if you go to the very top, there's a button called for Spanish resources. So that's a really good option if you have a need there for Spanish resources, and if there are other needs that you have for other languages, the state has additional resources. So please let us know if we can help with those. As we go along down our website, we just have some general information on social distancing, one of the best things that we can do to prevent the spread of this virus. We have a link to our social media pages and some packets for information about if you were exposed to COVID-19 or you think you were exposed. And then if we go here to our Safe, Smart, Strong section, there's a button right here for frequently asked questions. You can go there and it explains a lot of information about what does yellow risk mean and general questions. So that's kind of our top page. And then this next section is the Davis County Low Risk Yellow Guidance. So this is part of the Utah Leads Together 2.0 guidance. And here we have guidance for individuals, general businesses, high risk, and then specific industry. So if you click on specific industry, you can see our daycare guidance right there. And this is the Utah Leads guidance, just in a more simplified way that's a little easier to process than their 20-page document. So hopefully that will be helpful to you. All right, and if we go down a little bit further, we have a resource download section where there are resources for businesses. There are posters and sign sections. So if you want to put some posters up in your daycare center, you're welcome to download those there. Or if you would like, we can print some off for you. Just let us know. And then this last module, there's a child care and school section. If you click on that, there's resources from the state and some other frequently asked questions that could help. So those are some resources on our main page. And then if you continue going through our website, you can see testing information, quarantine isolation, mental health resources. So just a lot of good information that can help you and the families that you're working with during this time. So then we're going to look at our dashboard for a minute. Let me just get over to the tab. All right, and it does look like we have a few questions maybe. Okay, we will get to those soon. Sorry, my webcam is right where I need to find this new tab. Okay, so if we go to our page, we're going to go to our dashboard. And on the dashboard, again, it gives us those numbers of what's happening with COVID-19 in our community. So this first graph is the number of lab-confirmed COVID cases in Davis County. So that's a daily count. And as you can see, we did have a peak there at the end of March, beginning of April. And we've done really good since then at kind of flattening that curve, as we've been saying. So that just gives us an update of where we're at. We also have the reported exposure. And this is really helpful in letting us know how is this disease spreading. So in the beginning of our pandemic, we were getting a lot of cases that were travel related. So as you can see over here, about 10% were travel related. And then this is really informational for us that almost 64% have been from a known contact. So that could be through a work site, through living in the same household. And we have had outbreaks in healthcare settings, in some businesses. So this is something that we want to monitor and really pay attention to. All right. And then we also have our hospitalization rates and the percent recovered. And right now that's at 80%. So we're really happy about that. If we go on this dashboard, there's another tab for phase risk indicators. And that gives us a 14-day look at our count. And that's really the time frame that the state's looking at for about every 2 weeks. What is going on with our different levels? Are we ready to move from one to another? So we we're looking at some of these factors, and we were able to move from orange to yellow because of some of these indicators. So right now we have 71 active cases, 4 hospitalizations, and we've had a lot of testing that's been happening. So if you're interested in this, there's a lot more data too that's available there. All right, let's jump back into our presentation. If you have any questions about that, again, feel free to ask us. Okay, so just to go over, again, something that's really important that we need to remember during this: how does COVID-19 spread? So this is one of the main reasons why we've had a lot of restrictions, is that it mainly is spreading from person to person through those respiratory droplets that can come from coughing or sneezing, sometimes talking. And spread is more likely when people are in close contact with one another. So close contact's defined as being closer than 6 feet for more than 10 minutes or 10 minutes or more. So this is really why we've had a lot of these restrictions, is to try and limit that contact with others. And in daycare, I know that's probably next to impossible sometimes, but we appreciate all that you've done to adapt to these crazy changes. So on our website, we do have those signage available under posters and signs. And these are just some reminders that you can put up. Again, trying to keep people to stay 6 feet apart. If they're going to be closer, wearing a mask. And Rochelle will go over some of those guidance specific for daycare. And then also just some symptoms. We don't want anyone coming to daycare that's been sick. So if they've had a fever, cough, shortness of breath, sore throat, those kind of things, again, we'd ask that they don't interact with others so that we can stop spreading this illness. There's also just some other general posters, so some good recommendations. Again, washing hands, covering your coughs and sneezes, and making sure you're not touching your face. Those can all help to stop and slow the spread of this virus. So again, why do we have these phase guidelines? So Utah Leads Together, again, it's a plan that helps businesses and individuals to balance our health and our economy. So this was guidance that's provided by professionals in many different areas with many different interests in mind. And again, it's to try and keep us safe and also keep our economy going. So these are statewide guidance that all of Utah is trying to implement at this time to keep our state safe. So what does it mean that we've moved to yellow? At this point, there are a few differences from yellow to orange, which we were previously in, which was that moderate risk. So with our low risk or yellow phase, we want to continue social distancing in public settings when possible. We want to make sure that if people are going to be closer than 6 feet, that they do wear those face coverings. And gatherings are now up to 50 people instead of 20 people. And again, that applies more to those private gatherings. If an organization is shadowing a gathering, then there are some size limits that are a little different there. And again, we still want to use smaller gatherings when possible, just because of how it spreads, that person-to-person contact. At this point, too, we're still trying to encourage limiting out-of-state travel, and then making sure that we symptom check before engaging in activities of close contact. And Rochelle will talk about that more within daycare setting, how that applies. So we want our high-risk individuals still to be taken really good care of, and to take a lot of precautions and considerations for them. So we want to be mindful that when we're interacting with high-risk individuals, that we're taking extra precautions, such as wearing a face covering or a mask, hand washing, those kind of things. So we moved to yellow on the Saturday, and if you want more specific information, you can go to coronavirus.utah.gov, and they have phase guidelines of all different industries and what it means for individuals and businesses during this phase. So we're going to turn it over to Rochelle now. She's going to talk about some general business guidelines and then things specific to daycares.
All right. Thank you, Kaylee. As mentioned, my name is Rochelle Blackham, and I am the Environmental Health Director for the Davis County Health Department. I am going to go ahead and share my screen because we are social distancing here in our office. So Kaylee and I are not even in the same place. Okay, so first we're going to be going through the Utah Leads Together document, and we're going to be reviewing the things that are outlined for general businesses. Throughout this document, there are multiple places that highlight different things for general businesses, but to follow along, they are on pages 2, 5, 10, and 20. We wanted to supply this link for you all because you can follow along, and or these guidance, as Keely already mentioned, continually get updated and changed. So wanted to give you this link here so that you can follow up in the future. So as we move forward, general business recommendations, the very first thing is take reasonable precautions. As Jay and I have been out in the field looking at different facilities and or reviewing plans, there's one thing that's clear, and that every single facility is not the same, even if it's within the same industry. So what you're able to do is going to definitely be a case-by-case situation, and that's shown in the guidance. But do what works for you, but take some precautions. I'm then going to go into encourage remote working, symptom screening, social distancing, hygiene, cleaning and sanitizing, face mask coverings, and how we can protect the high-risk individuals, other practices, and lastly, we have a slide where you can find the specific things for daycares, and we'll then be doing the question and answers as Rob talked about. So first off, we're encouraging flexible working arrangements because telework is still preferred. If you can have meetings with all of your teachers or all of your parents, we are asking you to do that virtually, as well as through phone calls, emails, different things like that. So you're eliminating the need for people to come together or have a gathering. As far as rotating shifts, this may be something that you would want to do within a daycare setting, so that you maybe it's not necessarily rotating shifts, but not rotating teachers with classes. Like you stick one teacher in one area and they stick in there, and so that you're not intermingling, which we'll kind of get into throughout the presentation. As far as exercising discretion when returning to the work site, this is something we want to just emphasize, that as we've moved from high to moderate to low, or red to yellow, we don't want to just all of a sudden everyone get out there and we flip the switch and everything's back to normal. We want to kind of encourage businesses to take a baby step approach, kind of like the dimmer switch as we move forward. And then we already talked about encouraging phone calls and virtual meetings instead of gathering in the same building. As far as symptom checking goes, you want to monitor your employees for symptoms. I noticed some people from schools, this might mean monitoring not necessarily an employee, but possibly a student helper for symptoms. And we'll kind of get through the symptom checks on the next slide. But of course, if anyone becomes sick, whether that's a child or a staff member while in the daycare, you want to immediately separate them from the other children or other staff members and get them home as soon as possible. You want to also sanitize the toys or areas that they touched as soon as you find out that they've have symptoms. And lastly, we are asking you to prohibit employees who have been instructed to isolate or quarantine until the health department gives them clearance to return back to work, which it's pretty clear in the guidance for daycares if there is a positive case that the facility may need to close. And so I anticipate working very closely with facility owners if there is a positive case within that area. So as far as symptom checking, again, monitoring employees is what it says in the general business guidelines, but this may be student helpers and or children. We'll kind of get into that. The symptoms include a fever, and what we're saying is a fever is 100.4 degrees Fahrenheit or above. It could be a cough, difficulty breathing, a sore throat, sudden change in taste or smell, as well as muscle aches or pains. We have a lot of questions about how do you want us to do this? I think that it's going to, again, be whatever works best for you. So there's a chance that we've seen businesses using QR codes where a parent can scan piece of paper on the outside of the door, and they can mark that their student, or not their, could be a student, child, excuse me, that their child doesn't have any of the following symptoms, and that they haven't traveled outside a certain area for in the last 14 days, and that there's no one else in the household that's sick. I mean, that's an excellent example, because that individual is only touching their own phone. It may be where the teacher, as they check in each student, is asking the parent these questions. I think, just being a mother of 2 and having young kids, my kids are not going to be able to answer these questions. So you're going to have to somehow ask the parent whether their son or daughter has these symptoms. And it's going to have to fit for whatever works for you, like we're saying. So you could stand at the door, do kind of like a drop off, ask them where you're the only one touching the clipboard, you're the only one taking notes. We obviously want to avoid the possibility of you passing around a clipboard or passing around the pen to all the different parents. So definitely encouraging you to think about what will work best for you. So there are specific industries in which they're asking you to take a temperature reading. That's a restaurant or a gym requiring the employees to actually get their temperature taken before shift. Obviously, it's a good practice regardless, but in this guidance, it's just asking daycare facilities to do a symptom check, not physically do a temperature reading of the children. Again, we already went over, it's 100.4 if you have a fever. There's been a lot of questions, again, on what type of thermometer to use. Obviously, we would recommend using a contactless thermometer, where you can just use a little laser pen and it will tell you what the temperature reading is. If that is not available and you need to do a contact, in the ear, we're saying use a new protection per individual. And if you haven't been able to find a thermometer, there are the infrared thermo devices that are not calibrated for taking human temperatures. So just note that if you're using that, because that's all you have available, when you get the infrared on your forehead, it's actually reading a 1-inch radius, and the temperature reading, the correct temperature reading for humans is 90 to 94 degrees. And so just wanted to point that out, because I know that there are limited resources and people are wondering how to apply those thermometers in this setting. Again, other industries are not required to take the temperature, but should screen employees. So we kind of talked about that. And I wanted to show, sorry, I backed up a slide. So this employee self-monitoring guideline poster is available on our website, and this might be helpful in the daycare setting where you're asking your employees and or students to take their temperature before coming and do a symptom check and assess their exposure. So that might be a good poster for you guys to have. So then, talking about what is an exposure. So I know Kaylee kind of briefly talked about this, but as an exposure occurs when somebody is within 6 feet to an individual that becomes sick for longer than 10 minutes. And we're saying that then that individual has been exposed. So if the individual is exposed, we are asking them to self-quarantine for 14 days. So the next thing I wanted to talk about is if you don't get sick that entire time, you still do need to quarantine for the 14 days, because that's how long it could take for you to become symptomatic. So just one more example. I know some people are in quarantine and then they go and get tested, and they, on day 5, find out that they're negative. So then they think they can return to work or come to the daycare and different things like that. And we just want to make it clear that they still, even if they get a negative test within that 14 days, they need to complete the 14-day quarantine just to ensure that they don't develop symptoms at that time. And of course, the Davis County Health Department, if it happens in your facility, will be there to answer any questions. Obviously, we will be reaching out to the exposed individual as well as the positive individuals. So talking about somebody who is positive for COVID-19, obviously, if they are positive, they should self-isolate, even within their own home. So that's what's concerning when you're running the daycares. If an individual drops you off 3 kids and brother or sister was sick, if you cannot see that brother and sister stayed in the same room, then that's not self-isolation, and the other children were most likely exposed. So talking about people again who are positive, when can they return to the daycare facility? And that is when they are fever-free and improved from symptoms for 3 days, and it must be at least 10 days from becoming sick. So some individuals, well, I was only sick for 2 days, I felt better, so now I dropped my kid off. No, that doesn't work like that. It has to be at least 10 days from when they first became sick or 3 days after they've had improved symptoms. And this virus affects everyone just a little bit differently. So, maybe somebody feels really sick for 2 weeks and then they start to feel better. So 3 days after they feel better, those different things. Again, there may be a situation where somebody tests positive and they've never even been symptomatic, never got sick. So in that case, we are saying from the date that you received your positive results, you should self-isolate for 10 days. And again, like I mentioned earlier, the Davis County Health Department will help everyone. So we have these exclusion letters, and this would definitely come into play if you had an employee who was positive. It may also come into play if you have a student who is positive that's working within the daycare. But this is just an example I put together to help run through how this works from the health department standpoint. The ABC restaurant does not exist, just for the record, at least not in Davis County. But trying to go back through and show you how this works. So if you had an employee who became COVID positive, said they were sick, got tested, we confirmed that they were positive, we, from my division or the epidemiologist department, would call your facility and ask, okay, so as you see there, Eric Olson, he became sick. We want to see who he worked with or had close contact with from the day he became sick to 7 days prior when he wasn't sick. We want to look at who he could have been in close contact with. From there, we're going to look at, we might ask you about your practices. Were all the staff members wearing masks? Like how many different classes of daycares did you have? Was that person only working in the morning? Did you sanitize between morning class and afternoon class? And we're going to determine how many people were exposed. And then we're going to give the facility an exclusion letter saying these employees should not come to work. We have not issued an exclusion letter for kids returning to daycare. So I'm not sure if we would ever reach that far. We would notify your facility if a child tested positive, and we would let you know when they could return to your daycare. But that's kind of a different thing. Like, they're not required to come to daycare. So most likely we would not issue a letter. It would just be us communicating those results with you. Okay, so social distancing, again, this is a big precaution that can be put into place to help reduce the spread of the COVID-19. So maintaining 6 feet distancing between others is a huge thing. Staggering workstations, not facing each other, limiting employee to employee contact, minimizing customer interactions and time spent in the facility, and limiting group sizes. So the way that this applies to the daycare setting, which I'll repeat in the industry specific, is trying not to intermingle the different groups. So if you have classes, you're going to keep those classes together, the same small group of people. You don't want to intermingle all of those classes, because then if someone were to get sick, all of those individuals would be exposed. So again, if you have 2 rooms, one room would stick together, one room would go out for playtime, that one room would go into the lunchroom, and kind of do it really individualized, and then sanitize in between. And as far as employees go, obviously we would encourage the same teacher or instructor to be with the same group of kids. And then again, just limiting those group sizes as much as possible. And when we say groups, they actually should be in like a separate room, is how we're saying they're separate groups. Unless you have a really large facility and they really truly can stay 100% separate. But when we say don't intermingle the children, we also mean don't intermingle like the resources like toys and whatnot. So as far as strict hygiene, this is huge. As you know, I feel like everyone knows that have kids that they have little sticky hands, it seems like all the time. So obviously hand washing frequently amongst staff members, as well as upon arrival for the children, that is recommended. Making hand sanitizer, soap, and water available for everyone. I know it's hard to ask little kids to avoid touching their face, but as a teacher, that's something that you can talk about. Avoid touching face. As far as coughs go, use best practice or etiquette where you're coughing into your elbow, shoulder, something like that, so you're not just projecting the spread of the virus. And I know that's super hard with kids again, but if you're wiping little runny noses or helping blow noses, make sure that the child and yourself are washing your hands after. Don't shake hands, and try to eliminate physical contact, which again, I think every little kid's gonna go hug the other kid. But don't do activities where you're high-fiving everybody, and try to avoid, hand touching as much as possible. As far as cleaning and disinfecting, we want you to regularly clean and sanitize your facility. That's normal. You guys do a great job at this normally. I know that every daycare that we are inspecting has a plan on when they wipe down tables and how often they're laundering stuffed animals and different things like that. But we are saying please increase sanitizing of high touch surfaces. So when you think, well, what's a high touch surface in a daycare? It could just be the opening, the door handles that might be on the toilets or the entry door. And if you can prop the entry door open or the back door to the recess open when it's time for recess, prop it open so all the little kids don't touch it on the way in and the way out. I mean, those are just thinking things through that you can minimize high touched areas of even touching them. And of course, if there's like that special toy or, all the desks, you're gonna wipe all those down in between classes. And then immediately clean and disinfect an area if someone becomes sick. And when it says disinfect surfaces between clients or customers, that's going to be the different classes that you have for the kids. As far as face coverings, so we will address this specifically for daycares, but face coverings should be worn by employees and patrons when it's difficult to maintain 6 feet in distance from one another. We believe it will help prevent the spread of the COVID-19, and it's really important for asymptomatic spread. So when individuals don't know that they have the virus because they're not actually sick, this will help that when they sneeze or cough that they're not spreading the virus. Couple more things. Just because someone has a mask doesn't mean that then they don't have to hand wash or don't have to social distance. We're just saying the mask is an additional precaution that can be put into place, recommended, for people in public, wearing one in addition to public health measures, and then washing it daily to help keep those masks clean is important. So there is some CDC recommendation on masks. So it says children under the age of 2 should not wear a mask. And also it says if an individual cannot take on and off the mask themselves, it's not recommended that they wear a mask. You want to make sure you can breathe through the mask. You want to wear it in public. Make sure as a teacher that it is covering your nose and mouth. And then obviously healthcare workers have separate guidance. And we will get to the slide specific for daycares. So when requesting personal protection equipment, like it's possible you don't have enough masks or enough hand sanitizer or gloves. And we want to let you know that there are state and local programs that are available to help you guys get those things. So if you're struggling, you're more than welcome to call us with the telephone number provided on this slide. If not, we've also supplied the link where you need to fill out an assessment and an order form. So on the assessment, it's going to ask you where you're from. It's going to ask you what kind of facility you are, how many employees and or clients you have, what kind of supply you currently have, and then it's going to ask you what you need so that we can prioritize and get those items to you. So when are masks and face coverings required? So according to the guidance, this is the guidance only, face coverings should be worn by employees and patrons when it's difficult to maintain the 6-foot distance. So that they're requiring it in restaurants, personal services, and then gyms, and then it's encouraged in retail, which is like grocery stores. As far as high-risk individuals, we want to protect those individuals as much as we can. So we want to allow anyone who is high risk, or we want to promote through the guidance that they're able to remotely work or have a staggered shift or flexible hours so that you can protect them by keeping that 6-foot distance. Minimize face-to-face contact with them. And then over here in the yellow, it does talk about who is considered high risk. So this is going to be individuals who are over the age of 65, any individuals that have underlying health conditions, pregnant women, different things on there. Other practices. So you want to avoid shaking hands or unnecessary physical contact. Consider different practices like contactless payment options. I don't know how that works for the daycare setting, but maybe setting up some Venmo or directly passing it to America First accounts or whatever you might have. I don't think partitions make sense in this area. Same with non-punitive leave policies, doesn't really make sense. I already kind of talked about propping the door open. I think too, for daycares, it may be important to have, I don't know if you call it a substitute, but what if as a caretaker, you're the one that's feeling symptomatic and you feel this pressure because all these other individuals need to work. I think it might be important to kind of figure out like who could step in and help me out if I became sick, at least to give enough time for these other parents to find somewhere to take those kids. I mean, that's kind of something to think about. Additionally, travel comes into play, and CDC has listed specific guidelines in certain areas that if you go to a hot spot, that they're saying after you return from vacation, you would need to quarantine for 14 days after you've returned. So that kind of comes into play. I think you guys as childcare providers know when people go on vacation, because little Bobby was missing for a full week. If he was missing for a full week, it's possible they went on a vacation and then not allowing them to come into the daycare 14 days after, depending on where they went, is a way to protect yourself and the other children. So looking at industry specific, so it says limit mixing of groups of children, and children from the same household can be kept in the same group if possible. So you can see, I definitely already spoke about this, but if you have, 4 siblings, instead of breaking them all up, if possible, you keep the 4 siblings together because they're already exposed to each other's germs and whatnot. So, each specific case is going to be different for each facility. So again, take the precautions that make sense for you and do what you can do, but don't have 2 separate daycare groups that you're just mixing, because then if someone becomes sick, all of those individuals have been exposed. Don't use toys that can't be washed or disinfected. That's an actual recommendation that we have in environmental health anytime we inspect a daycare. But at this time, if you have, like reading areas or blanket time or quiet time, and you supply stuffed animals or blankets, we're asking you not to have those available right now. And then regularly sanitize high-touch surfaces, which may include the toys, because if you're allowing all the kids to play at the toys, you're going to need to sanitize all those toys in between each groups. So it may limit down to the amount of toys that you have available, because that might be a lot of cleaning. Again, if there is a confirmed case, I might read it word for word here on the guidance. So the way it reads is, if there is a confirmed case, the facility must close and alert the health department. So I have on there may be closed. There may be circumstances where you only had 1 or 2 people, it just really depends. But in the guidance, if there is a case, we will close. They're asking you to close and alert the health department. And this can be found on the guidance in page 17 that I'm going through. So all individuals must wash their hand upon arrival. If if I were running a daycare right now, it wouldn't make sense to have additional people enter the facility. So we wouldn't want mom and dad to be dropping off the kids and coming inside. If it's possible to stand outside and just have the kids hand sanitize or wash hands quickly as they enter, that would be what we would encourage. Children and staff are screened for symptoms. That again is not a requirement for you to take the temperature immediately. It's more of a symptom screening. So you're going to use a questionnaire, or like I said, you're going to have them fill it out before they drop off the child. There's different ways to do that. I'm not saying you can't take the children's temperature. It's just not required in the guidance, and any precautions is recommended. So not allowing symptomatic children or staff to enter the facility is what we're recommending. Must restrict off-site activities where social distancing cannot be adhered to. So when you go on field trips and different things like that, you want to go to places where the classes can stay separated, or the small groups can still stay separated from other classes, other public members, and even your own classes. So on mask requirements, this one has been definitely bouncing around. I know we have some questions, so I'm going to wait for the question and answer section on there. It used to require people to wear masks. I think there's finally been some guidance, just in the fact that obviously it's difficult for a bunch of little kids to wear masks. So the instructors should wear the masks, and we'll answer the question. I think they've been coming in. I think they've been getting answered, but we'll clarify that in the question and answer. And then the Utah Child Care Resources, just wanted to let you know about these two links. The CDC guidance for child care programs that remain open. These are both great links to go find more resources for child care facilities. And so we just wanted to make sure that you had those. Lastly, before we get to the questions, I know masks is a big one, but COVID-19 things to remember. We are still learning about the virus that causes COVID-19. I think all of us know that. And currently there is no vaccine to prevent COVID-19. The next one here is the best way to prevent it is not being exposed. That makes perfect sense. Of not allowing people who are sick to enter a facility, wearing a mask, staying social distance, all the things that are encouraged in the guidance. Take extra precautions for high-risk population. Unfortunately, that is the population that is being impacted, and we need to protect them. And then individual responsibility. We'd really like to hope that the individuals who are sick stay home. If you know someone that's sick, encourage them to stay home. We're hoping that they by staying home, that they stop the spread. And then individual responsibility of our community partners like you guys. Try to adhere to the guidelines as best that you can, so that we can all help prevent the spread. Before we get to the question and answers, I see them coming through. And so as I'm presenting, I can't actually see the questions and answers, but I know Jay's helping me out. So wanting to give our contact information. So environmental health. So we are the individuals who do inspect like the food portion of daycares and help out with complaints at daycares. We inspect just basically everything that your local health inspector would inspect. So wanting to give you our telephone number if you have any additional questions in the future. As far as nursing, we've provided the nurse line. As far as medical questions, we have provided the nurses line. This is when you have a positive case or quarantine questions and different things like that. You want to visit our website, which Kaylee already went through. So we're just providing the links so that you can find those resources. And then currently our tagline right now is the Davis County Safe, Smart, and Strong. And I believe as all of us move forward with these guidance, we can definitely meet that. And then I'm going to turn the time over to Rob to tell us about this slide.
Perfect. So I'll be quick so we can get back to the questions. So the first one is just my direct line for Davis County Economic Development. Please feel free to call me if you have any questions regarding your business, financial assistance. The next one is the Small Business Development Center. That's at the Davis Tech College. That is the Small Business Development Center. Their whole purpose and existence is to help small businesses with business planning, with growth modeling. So that is Andrew Willis's number. He's the executive director for the SBDC. Many of you are aware of the Commercial Rental Assistance Program that was passed by the state legislature, where they provided $40 million to help with rental assistance. As of last week, there are still $30 million available. So that's a link to give you more information on where to apply and at the state. And then last, with Weber County, we created the Northern Utah Economic Response Team. And that is the website for there that has a lot of really helpful links for business assistance and things like that. So with that, we'll go to the Q&A portion. There has been some questions already answered, so I'll briefly go over those answers just so everyone can see them. And then if you have any questions, please feel free to put them into the Q&A. So a lot of them are related to masks. So Alice asked, after the CDC recommended wearing a mask, I asked the health department if we should be wearing masks. I was told yes. It would be good if I did, not the kids. Is that still recommended? And Jay said this formerly was a specific requirement for daycares, but the guidance documents now have omitted it and not addressed it. This means it may not be a consistent answer, the safest thing to do is to wear a mask. However, if this leads to kids being scared, you may need to modify practices to do what works best for your daycare setting. And then he also included the link to the CDC's guidance for childcare masks. And that just kind of says that when feasible, staff members and older children should wear face coverings, but not to put them on babies. And I believe we mentioned children under the age of 2 for the dangers of suffocating. And then Kate asks, if an employee develops a cough or feels ill, but gets tested negative for COVID-19 and begins to feel better, are they required to wait 3 days or 10 days? Or is it only if they test and are exposed to a known case? And Jay wrote that a negative test in most instances is sufficient to return to work. However, if the person has a known exposure, they need to quarantine for 14 days. And then Tiffany asked that, so what I'm understanding is that we need to avoid kids playing together. I don't know about others, but our preschool is about socializing. Are you suggesting just having instruction, not allowing kids to play together? And Jay said, we understand there are various circumstances. The overall message is just to do what you can to minimize chances for cross-contamination. We know it's not easy to do this in these settings. If you have a large number of kids, try to separate them and keep them with the same group. Chelsea said, I came in late. I called the health department asking about masks. They told me we do not have to wear them. Do you want me to have staff wearing them constantly? Jay, this is going to be a determination on a case-by-case basis. The safest thing to do is to wear masks. However, this may cause fear and anxiety among the kids, and you will need to decide the best course of action. Hannah said, the current guideline states curbside drop-off and pickup, but the new guidelines don't mention it. Should we still be using that? And Jay just said, under the low risk, it's no longer a requirement, but you may choose to still do this, but you're not required to do so. Tiffany asked, what size of groups are you recommending for preschools? And Jay responded, there is no longer a specific number in the guidelines. This would be up to the business owner to decide. And then Chelsea asked, how can we make sure for field trips like swimming or a science museum, for example, would it be better to host field trips activities in our center in small groups instead of going out? And Jay responded, this would be circumstantial as well. The goal is to minimize the number of contacts. If you are the only group at a facility, it may be okay. But if you have to join a larger group, you may want to forego this.
I think, Rob, with that one too, I know all of you have good relationships with the places that you normally take your kids for field trips. So you could reach out to the businesses. The pools are adhering to different guidelines, and so is the different events or entertainment areas. They're adhering to different guidelines. So it's possible, support the businesses that are doing a really good job and have things in place for you to be there. So calling ahead may just help out with that.
Perfect. And then Hannah asked, what about snack time? Any guidelines or recommendations on that? And Jay responded with, the normal food safety precautions apply. Wash hands and use prepackaged items. And then a question that came in, Crystal said, so are these guidelines following childcare licensings, or just the CDC? I am seeing some information that is provided that is different than childcare licensing, such as drop off and pickup.
Crystal, that is a really good question. Childcare licensing is, of course, the facility that holds your permit. And if you're a permitted daycare, then you do need to follow the guidance that they've provided. The health department does not permit daycares, and the guidance that we're reporting on today comes from the governor, and then we're giving additional information about CDC guidance. What I can say is that the governor's guidance is changing so frequently that it's possible that the daycare licensing just hasn't released a new edition, mainly because the governor's guidance that we're basing our low risk guidance off of just came out on Friday. So I would recommend reaching out to child care licensing and seeing if they have an updated version. But of course, considering they issue your license, we would recommend following everything that they have asked you to do.
Thank you. Great question. Any other questions? I believe we've answered all that came in. While you're typing out those last minute questions, I just want to say two things. One, the webinar is being recorded, and by the end of the week, we'll have these posted on the health department website or on just the main COVID-19 website for the county. So you can go back and listen to them. And if you have any questions and we think, oh, what was it they said, then that would be a resource for you on that one. And then also we'll be sending out an evaluation form about this webinar. We just want to know how we can improve. Part of, as I mentioned earlier, with this technical assistance we're offering, we're planning out additional webinars we can do that could help the business in the county. So just please look out for that link. It's just a quick 6 to 7 questionnaire, so shouldn't take too long. So any other questions? You could also raise your hand if you have a last minute question or a longer question that you don't feel like typing out, and we can get to that as well. Perfect. I don't see any hands raising, so I just like to conclude by thanking our panelists and also thanking all of you for joining us today. We hope that this was helpful and we answered some of the questions that you had. Feel free, as we mentioned, to reach out to the health department or my department. We would love to help answer any additional questions you have. We wish you luck, and thank you for doing the great work that you're doing and such the important work. And thanks for joining us today. Have a great day.